This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. Delighted you're with us today. And today we want to talk a little bit about why people maybe want to consider healthcare as a career. It can be quite rewarding. We're delighted we've got Patrick Rohan with us today. He's the Chief Executive Officer at Medical City Frisco. Patrick, welcome to the show.
Hey, good morning, and thanks for having me. I'm glad to be here.
Let's just kind of start at the beginning. What motivated you to consider entering the field of healthcare?
Sure. I grew up in South Florida, and growing up as a child, my mother was a nurse, father was a firefighter, and had the ability to grow up and experience through them the impact of giving to others, giving to their fellow human, giving to their community, how rewarding it was when they came home. And got to see that even more as I grew older and got to go to the firehouse or got to go to the hospital and hear their colleagues, their peers, and people they worked with kind of just brag on them about how great it was to work with them and all the great stuff they got to do. And just seeing that throughout my early life, adolescence, and just the passion, the reward of it that they saw through their eyes just really got me interested in getting involved in a field that I didn't know at that age specifically would be healthcare. But I knew I wanted to do something that, taking my talents, my abilities, whatever my strengths were, and finding a position to focus on of leveraging those to give back and experience that same feeling I saw them have growing up.
As you look at the field of healthcare, there's the business side, the clinical side, obviously working in a hospital, working in nursing homes, et cetera, et cetera. How did you finally narrow down and decide what role you wanted to play?
Sure. So I took one biology class in college and knew immediately it was not going to be the clinical side. I have the utmost respect for our clinicians, whether it be a nurse, a physician. That pathway is incredibly challenging and requires and demands a lot of intense dedication and focus to the profession. With that said, I started, taking more and more business courses throughout my college and postgraduate curriculum, and really, I think just it clicked more for me. And then I think it really solidified when I took on my first, I would say, resident role or intern role, as some maybe experience it. And I got to sit in a COO office at a hospital, while I was doing my graduate degree, and really see the day-to-day workings of more of an operational side and a business side of a hospital. And every day for the COO I was working with was different. Some was focused on, one day was focused on construction, designing a new build. One day was focused on a budget and preparing, next year's financials. One day was looking at labor management. One day was rounding and talking to the staff, and that variability combined with the core business tenets of finance, strategy, planning, that really just let me know that this profession, hospital business and hospital administration, that's the pathway I want to go down. Just made much more sense to me, clicked for me right from an early age of my career.
Patrick, regardless of what career people take, when you're on the job, you're going to have some days that are just days that you feel really good. There are other days that are challenging. As you look at your career, what are some of the most rewarding days you've experienced?
The reward really comes, I think, from the people side of what we do. And, we always have goals that are, great to achieve, whether it's volume or earnings or, patient experience scores, things like that are tangible goals. Those are always fun to be successful at and meet those. But what is the most rewarding personally for me, and I say the people side because there's multiple angles I look at it, is seeing the impact that we can make and have with the people that walk in and out of the hospital. And that's not just patients, it's our staff, it's the family members of our staff, the family members of patients. And some examples to me are when I get to see a colleague or a staff member progress and really advance their career and get promoted, and especially into some bigger leadership roles, that's really rewarding. When I get to have interactions with patients, in the hospital or post-discharge about their words of how we made them feel when they were here is also the most rewarding. It's something that if I am having, to your question, a more difficult day or a more challenging day personally at work, how I really, I think, address that or try to level set and get grounded again is to go around in the hospital and talk with staff, sit there at the station, lean against it, and have just more of a personal conversation and connection. Go talk to patients, go talk to family members that are waiting while their loved ones in surgery are getting an imaging exam done, et cetera. That really is the most rewarding, grounding part of this job, and really, I think, recenters your focus and recenters the why you're here, why you're doing this.
In your role as CEO, it's obvious that you're the leader of the hospital that you represent. But at the same time, you have to be a mentor, and you have to help your colleagues, especially if they're having challenges. How do you view your role as CEO in mentoring and helping colleagues with challenges?
I think that's more true over the last 2 or 3 years than any other time. I think people are experiencing a combination of challenges, be it professional, personal health, pandemic, finance, recessionary, trends, things like that, I think are just compounding stressors on just their day-to-day job. My role is to be, a sounding board, is to be available, accessible to everyone. And that's not just our leaders that we consider, quote unquote, pure, true leaders as managers and directors, supervisors. This is for all of our staff. Every orientation, I speak to the incoming colleagues and let them know, and I truly mean, like, my door is always open to discuss and talk about their career, their just life, if they need to just chat and bounce something off that they want to convey, or, have an ear to bend about something. And, prime example is, I had an employee, I believe last week, that is one of our surgical techs, and just wanted to talk about kind of what their future potential could be. And I think if you hold true to kind of what your commitment is, that really buys engagement and ties in the team to be dedicated and to continue to work through, some of the most difficult times in this profession. And I think we've been able to do that, not just myself, but I asked my team to have that same mindset. And I think that's worked well. And I think that's one of the most important parts of being a mentor is giving that availability and accessibility as a CEO, because some of the comments, or one of the more trended themes I hear is, I worked at other hospitals or other healthcare facilities, and you just really don't have that ability to just call, text, email the CEO and see if you can get some time with him or her, and it's just really nice to have. So it's something, again, I enjoy doing, but I think it's one of the most important things to be able to do in today's time.
These are the wise words of Patrick Rohan. He's the Chief Executive Officer at Medical City Frisco. When we come back, if your teenager could ask Pat Rohan a question, it would be this one. Next on the Human Side of Healthcare.
This is the Human Side of Healthcare, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back. We're talking with Patrick Rohan, who is the Chief Executive Officer at Medical City Frisco. This is a beautiful facility. You can see pictures of it online if you just search it up, Medical City Frisco. And they are expanding, adding about a third more capacity. Steve?
To our listeners out there, and especially the young people that are deciding on a career, here's a question I bet they'd ask you. Tell us, what are the advantages of going into healthcare and choosing it as a career?
Sure. So to start with any career, and I tell the people I work with, back to the mentoring conversation, is whatever you decide to do or want to do, you got to enjoy waking up and driving to work. And if you don't do that, and if you go more for a career that is financially driven or motivated by the potential salary or earnings or, stature and a title, and disregard the happiness factor of your drive-in, then it's never going to be a success. With that said, healthcare, why I think it's an excellent choice for a selection and career is one, sustainability. There's always going to be a demand and a need for healthcare leadership, and I think that's going to not only be stable now, but it's going to continue to grow as the population grows and ages. There's going to be more and more of a need for that profession, and depth and bench of people to take on some of the more critical management and leadership roles and across the country and in multiple venues of healthcare, whether it be hospital, whether it be physician offices, urgent care, long-term acute care, nursing homes. I think that's one of the greatest benefits of this job is kind of not job security, but just the overall demand and sustainability of it is great. The reward I think you get from having an impact on people's lives, not only in the immediate, ability to take care of someone, but just the long-term impact that a person has experiencing whatever offering or whatever area you work in with you is just of the utmost reward of a great feeling you can get. And, we had a patient's husband call me, and, when someone, asks for the CEO's phone number, one of my colleagues or one of my staff will say, "Hey, so-and-so asked for your number. They want to call you. Can I give it to them?" And historically, that's never going to be a great conversation. Typically ends up being some opportunities they want to, convey to you. But when the husband called me, it was about his wife and came to the hospital, had a procedure done, and was in and out within, 48 hours, right? And you don't typically get to see the post-discharge impact of what your team is able to do. And they just said they've been in healthcare in 20 years in this market, multiple hospitals, both patients and working, and this was by far the most wonderful experience they had at a hospital. And not just the cure and taking care of them was one part, but it was how they were made to feel as a family. They were made to feel as just individual people and not just another patient. And then donated, to our hospital employees $20,000 for our, Hope Fund, which is something that employees utilize in times of need for financing, difficult situations they may have. And just that part of it, choosing healthcare, getting to have that connection is, again, one of the biggest rewards you can get every day doing this.
Patrick, what's the hiring landscape at Medical City Frisco now? Are there jobs available?
Sure. So great question. There are jobs available, and especially very excited. We're finishing a $91 million new tower expansion that's adding 36 beds to the hospital, which will bring us to a total of 98. And we're hiring all over the board. We're hiring nurses, we're hiring techs, and we're hiring front office, food and nutrition, environmental services, lab technicians. And it's a great time to be part of the Medical City Frisco family. And obviously we have our website that has all those jobs lined out. Great benefits, great support for growth, and would always entertain any even listener that wanted to talk about a future career here at the hospital.
Well, that's awesome, because I know so many people are concerned about the economy now, and as you've said, this is a great place to kind of seek a shelter in the storm, if you will.
Yeah, it is. And again, back to the conversation about, I think a stable profession and a stable career is, I'm very proud of not only Medical City Frisco, but our parent company, HCA, and the organization. The most important asset we have is our people. And even when we went through the pandemic at its height, from March of 2020 to today, we made a commitment across all 182 hospitals that we weren't going to furlough anyone, we weren't going to term anyone or have layoffs, and we kept every single employee employed. Even when there wasn't work to do and they were at home, we paid them 70% of their salary until the work came back. And that's just one, I think, an example in a time of how we treat and how we have a philosophy of who our employees are to us and their family, and that's how we treat every single one of them.
Yeah, I'm glad you mentioned that period of time that most of us would rather forget, those 2.5 years of the really intense time when healthcare was in such a spotlight. And I know that the dust has settled from that. So as you walk the halls now, how are the employees doing that they've had some time to get things back together and establish more normalcy?
I would say they are back to, I would say, even above baseline before the pandemic in terms of their engagement, in terms of the positivity and the culture. And I could tell that two ways. One, we do a biannual employee engagement survey where, we have an engagement index, and that scores, I think it's about 10 questions. And the two of the questions that give us kind of the best reading of engagement or highly engaged / happy employees is, do you enjoy working here, and would you refer to a friend? And if they answer the highest score, a 5 out of 5, let's say for both, that's what we consider highly engaged. And over 4 out of every 5 employees answered, 5 out of 5 or a highest rating for both of those. I think it was around 81, 82% highly engaged. That tells me the numbers that the workforce is really engaged, culture is good. But when I walk the halls, the positivity is palpable. You feel it. The team works collaboratively, not in silos. There's a lot of good energy and conversation and smiles and, talking when I walk through there about families, about what they're excited about, the school year, the sports, the vacations. It's a really good time. And I think that the hospital staff and colleagues weathered the storm and rebounded, I think, even better coming out of it than the way that they were going into it.
And I'll bet another thing, you have a beautiful facility. Anybody can just get on the website and take a look at Medical City Frisco and see how incredible the building is already. But I'm sure that it's full of nice new technology to make everybody's jobs integrate better. And that was a piece that you and Steve didn't touch on, the technology side of healthcare, which, from your perspective as CEO, you have to acquire it and keep it running. But even outside the hospitals, there are people who develop a good career selling it to people like you as well.
Yeah, I would say, we put a heavy investment in technology in this campus. On one side, I will say nursing. We provide at the hospital, iPhones for all of our staff. Every single staff and employee gets what we call iMobile, an iPhone. It's connected with all the physicians, all the different departments. It allows for ease of communication and orders, and being able to just integrate the entire network of all of our colleagues and our patients into one device that everyone has. And that's just really streamlined the ability to get things done, to communicate, which is typically the biggest challenge in our profession. And so that was a huge win for our team. I think the other kind of technological advancement is, I think it's little known or not maybe well known. We have the most robotic platforms and surgical advances and technologies in this area. And we have, I believe over now 8 different robots for different service lines like spine and joint, and general surgery and 3D augmented reality, spine navigation, and probably about $8 or $9 million of, I would say, robotic and navigation platforms in our OR, because we're an immensely busy surgical hospital, that have really provided great patient outcomes, have really drawn physicians to come to the hospital. And in this market, they're the ones that really dictate, where the patients go, and have the trust and confidence based off our investment that we're the destination of choice to bring their patients for care. And that investment, I think, has paid off and has built that great experience, the great quality in a facility or destination to take care of.
Patrick, you've done a great job explaining about your personal choice to go into healthcare. As we close this interview, do you have any final thoughts or words of wisdom to people considering healthcare as a career?
Yeah, I think final thoughts and words of wisdom is there's going to be ups and downs, and there's going to be, really challenging times, and it's focusing again on the why we all got into it. Is we're taking care of people in their most vulnerable time, or one of their most vulnerable times in their lives, and where their comfort, where their support at that time, and that's the real why. And whatever the challenge may be, that really kind of helps focus and ground us of what we do as healthcare leaders.
We've been listening to Pat Rohan, who is the Chief Executive Officer at Medical City Frisco. And those positions that he mentioned that were open are listed on their website. Now, when we come back, we're going to talk about some documents that you should have in order, that if you don't, and you had an accident and were rendered unconscious, a committee might be in charge of your health. Do we have your attention? Find out what we're talking about next on the human side of healthcare. We'll be right back.
Welcome back to the human side of healthcare, where we explore how to take better care of your health so you can live a happier, healthier life. With DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're going to be talking about advanced directives, and we couldn't have a better person to discuss this with than Krister White, who's a certified educator and also a director of spiritual care at Parkland Health. Krister, welcome to the show.
Thank you, Steve. It's good to be with you.
You know, I'm sure some of the listeners may not know what we mean by advanced directives. So can you define advanced directives and why they're so important?
Yeah, so advanced directives are basically a legal document that allows you to spell out what you would most like when it comes to end-of-life care, or who you would like to make that kind of decision for you if you were not able to. These documents are really helpful. As you can imagine, anytime somebody is in the hospital, it's a time of great stress for the family, and knowing what a loved one prefers when it comes to end-of-life care helps to take some of the burden off of the family and allows that person's voice to be respected and honored as they approach the end of their life.
You know, I know these conversations are not easy, but would you recommend talking to family members in advance and discussing these in detail?
Yeah, I do. I do recommend those conversations to take place, really as soon as possible. As you mentioned, they are stressful conversations for us to have. None of us wants to talk about our own death or about what we would want, if we were to find ourselves in a place where we were not able to speak about what we would like. And so the sooner to have that conversation, the better. I think this is great that you're having this dialogue now, and to have a difficult conversation that doesn't have to last really long, but it does need to be involved so that everybody feels like they understand what everybody would want if they were to find themselves in that unfortunate position.
What age should you begin these discussions?
Yeah, I think even though it's hard to think about this, anybody over the age of 18 can do these advanced care planning documents. So good to have this conversation with college-age children, helpful to have these conversations as young adults, because like you said, you never know when you might find yourself or find a loved one in an unimaginable situation. So the sooner the better.
As you counsel people and work with them regarding advanced directives, what advice do you have if when they talk with family members, those family members don't agree with what they want done?
Yeah, that does come up sometimes. The best that we can do from our perspective, and I'm a chaplain, and so a lot of our chaplains are having these dialogues with families who who may not have the same idea about what is best for their loved one. What we try to do is we try to help patients and others, find somebody in the family who is going to be an advocate on your behalf. Make your wishes very clear to that person. And you probably are going to want to select that person to be your, what they call a medical power of attorney. And that'll be the person that the medical team would actually be speaking to basically back up the decisions that you've already made about what you would like. But as you mentioned, there is going to be sometimes some conflict within a family system. There's not a lot that we can do to avoid the conflict, but we do really recommend that people find at least one or two people, maybe an alternate, that they would select to provide that same decision on their behalf.
You mentioned advanced directives, and then you mentioned power of attorney. How many documents are we talking about?
I usually recommend 2 documents. There's one document that's called the Directive to Physicians, Family, or Surrogates. It goes by the name The Living Will, and that's a document where you can spell out pretty succinctly what you would like as you approach different treatment decisions in your course of treatment. That's basically how you communicate to the medical team. You're saying, this is what I would like if I find myself in these situations. The other document is called the Medical Power of Attorney, MPOA for short. And that's when we're going to ask people to select somebody to make decisions on their behalf if for some reason they're not able to voice their preference. And so I usually ask family members and patients to fill out one of those documents, and oftentimes both, so that everybody's on the same page about what they want.
You know, in the medical power of attorney that you mentioned, if you're incapacitated, would that be also in a situation where someone was in a coma and there was decisions that needed to be made?
Certainly, yeah. So anytime somebody is incapacitated for whatever reason, whether it's a coma or they're just not able to speak for some reason, this form is what we would kind of depend on to say, who is the next person that we need to speak to make sure that we can honor this person's wishes.
Krister, this is Thomas. I'd like to follow up on that. If you had a advance directive sitting at home in the dresser somewhere, and you were in that situation, you were rendered unconscious, and you said, I do not want to be resuscitated, are you saying that those two physicians in that moment, unable at 2 a.m. to contact the next or even find the next of kin, that they're going to keep you alive?
Yeah, it's a requirement for physicians. Unless they know otherwise, they have to treat to help the patient remain alive. If we happen to have the information, let's say that it happens to be in our electronic healthcare record, at that point, we exhaust every option to communicate and to speak with next of kin. For a lot of our patients who don't have people, sadly, that conversation then becomes a conversation for an ethics committee. And between the ethics committee and the treating physicians, at that point, they would be the ones who would make decisions. So for the most part, we're really trying to get in touch with at least legal next of kin in the absence of these documents.
Then this becomes a really big scenario that probably a lot of us have overlooked.
Yes, definitely. Yeah, this is probably the most important thing that I know that my team is involved in terms of how this impacts families and how it impacts medical care at the end of life. And it's one of those things that you don't even think about until you find yourself in that situation, and by then it's too late.
To our listeners out there that may go, hey, I know I need to do this, but I can't afford an attorney, what do you tell them?
Well, thankfully, the forms themselves do not require the use of an attorney. So we use the language medical power of attorney, but these forms can be completed just within a family. The forms themselves, you can find them online, you can find them at any hospital or hospice. Those forms are going to be able to be filled out by hand. You will either have two witnesses who will sign the forms that basically make that form a legal document, or you can use a notary who can also notarize the document, but it does not require the use of attorneys.
So, Krister, what do you advise people if they travel a lot? Or let's use an example. They live in Oklahoma, but they work in Texas, and they cross the state line. They're involved in a serious car accident. Do the states honor different states' advance directives?
We do, yeah. So if you come to us from Oklahoma, for example, and you hopefully happen to travel with your advanced care planning documents, the physicians and the other medical team here at Parkland or any hospital in this area are going to honor that document because the document is just kind of a way to deliver your wishes. All advance directives are honored across state lines.
So I've completed the forms. What do I do with them? Because I could be involved in a car accident. They take me to a hospital, but I don't have those forms with me.
That's a great question. So probably your best bet is once you have completed the documents, they've been witnessed or they've been notarized. At that point, it's a good idea for you to make copies of the documents themselves. Give copies of those documents to loved ones. Make sure especially that your medical power of attorney has a copy of that document. And if you have a medical home, let's say that's Parkland or Baylor or Methodist here in the DFW area, make sure that you send them a copy of that so that they can upload that into your electronic health record. That way, if you were to come into that hospital system, we would already have that information on file about what your wishes are.
If you've given power of attorney to an individual that they themselves have become incapacitated or passed away, what are your thoughts about what the person should then do?
If a patient or if a member of a family knows that this person is no longer going to be able to serve in that capacity, it would be a good idea to draw up a new medical power of attorney with somebody who would be available. One of the things that is a part of the medical power of attorney already is the ability to elect alternate agents. So just in case your MPOA is not available, you might select one or two other people who could fill that role in the event that the MPOA was not available for whatever reason. So the first part would be, if you already know, go ahead and fill out a new one with a new alternate agent. And if you are not able to do that, hopefully your medical power of attorney already has an alternate agent selected so that we know who to go to next.
You know, for our listeners that really want more information and they want to do a little more research before they fill in the forms, any advice on what they can do or where they can go? Certainly,
yeah. A couple places. Here at Parkland Health, you can go to our website, www.parklandhealth.org, /ethics-resources. That's going to give you all the information related to advanced care planning that we have for Parkland Health. You can also go to the Texas government website, which is www.hhs.texas.gov /advance-directives. And that will also bring you information about all the different kinds of documents that are available and how to fill those out.
We're talking with Krister White. He's the Director of Spiritual Care at Parkland Health. We're talking about, obviously, advanced directives and medical power of attorney. When we come back, we're going to talk about how dementia might play into this and ask Krister about using technology to really make your wishes known. Check out our podcast, The Human Side of Healthcare. It's on all the major podcast players and on YouTube. Human Side of Healthcare will be right back.
Covering the healthcare topics that matter most to North Texas. This is the Human Side of Healthcare with DFW Hospital Council CEO Stephen Love, along with Thomas Miller.
Welcome back. We're talking about advanced directives and the medical power of attorney. Our guest is Krister White. He's the Director of Spiritual Care at Parkland Health. These are two documents that if you don't have on file with a hospital system or that you don't have with you in the case of an accident, as you heard in the last segment, it's possible that even a committee would be deciding your care. And yet, it is a delicate subject to address.
Our listeners out there say, you know, Krister, you make a lot of sense, but I just don't know where to get started. This is a delicate subject to bring up to family members. What is your advice?
The way that I would probably address this is, at least in my own family life, nothing happens unless it's scheduled. So I'm thinking maybe a few weeks down the road, if it were my family, I would say I would really like to spend maybe 30 minutes to an hour for us to have a conversation about what I would like in the event that I were not able to make decisions for myself. You know, have the conversation. You may even have copies of those documents available. Those documents are readily available online. You can just search online for advanced directives in the state of Texas, have those printed out, make everybody aware of what you're wanting, and then see who would be willing to serve in that medical power of attorney capacity. And really, that person's only job is to back up the decisions that you've already elected. You've already decided about what you want if you find yourself in that situation. So, like you said, it is a very delicate conversation. Death denial is a real thing. But if we don't have these conversations, it creates a lot of heartache down the road and a lot of confusion among families.
What if someone is in a situation and they don't have a designated power of medical attorney and they don't have advanced directives?
Yeah, that's a great question, and that happens frequently. You know, there is an established kind of tree that we kind of move down when we have somebody that comes into the hospital who is unable to make decisions for themselves, or at least for the time being, they don't have people with them. So we're looking for who is considered the legal next of kin for this patient. And whoever is considered the legal next of kin, whether that is the spouse, if there is a spouse involved, common law partner, if there is an adult child. So we're kind of going through a list to figure out who is the next person who would be in line to make this decision. So, part of the work of the medical team is to make sure that we can stabilize and to try to help every patient that comes through our doors. Sometimes it's really difficult for us to locate legal next of kin. And in the absence of that kind of information, you have a couple things possibly happening. One of them is you may have somebody who kind of plays the role of a surrogate decision maker until we can locate the legal next of kin. The other option, depending on the nature of what the concern might be, is you might have to have two doctors fill that role and provide a two-doctor consent.
Krister, this is Thomas again. Let me give you a scenario that I'm familiar with. This is a person who has been active even into her 80s. She has dementia, but she has still maintained self-sufficiency. When she had her full faculties, she did her documents and had a designated medical power of attorney. A few months ago, she broke her leg. It will never be weight-bearing again. Care options at home were not possible, so she's in a facility. Her directives said that if she could not be self-sufficient, that she wanted to go on. However, after her surgery, it became a point of contention because the medical team said that she could survive, which obviously she could, and that was not what she meant. So now she is laying in a bed in a facility. Thoughts on that?
Well, I think what the physicians and what others who may be involved might want to better understand is, what is the spirit behind what this person has written down? Is this quality of life? Is this what they would want? Or if this is not in line with what they would consider to be a life worth living, how does the family, in this scenario, help make decisions that are going to support those wishes? And can those be communicated with some unanimity among the family so that they feel like that they're doing right by this loved one? But it's very common for families to disagree about what somebody has written in their advance directive to the physician, for example. But yeah, it's a very difficult situation.
Well, and it brings as I was processing this in my own mind, dementia has an impact, or is kind of the thread here. And of course, so many people have that. I even thought of this. Tell me your opinion. I don't know if this would even work or if it would hold up. If you recorded a video in your faculties, so somebody listening to us, they're saying, wow, I don't want to be in that situation. What could I do? You record a video when you still have all of your capabilities while you're creating that document. And you note the referenced video in the document saying, I recorded this video on such and such a day in sound mind. This is what I want in case there's any confusion. And you say in the video, I do not want to be in a state that other people are having to take care of me while I look at the clouds waiting for my life to end. Would that work, do you think?
Yeah, I think more than likely the family would want to bring the video in and play it for the attending physician and probably for the treatment team to say this is what their wishes are. I think one caveat to make is that dementia in and of itself is not a terminal condition. So just because somebody presents with dementia and has a leg injury, for example, we may provide certain treatment options that are going to keep somebody comfortable, but this person is not going to die immediately. They're going to be likely on hospice or on long-term care for a number of months or even years. So I think it's great to make use of whatever medium is available to you to make sure that you're communicating clearly what you would want in specific scenarios.
Are there any universal do not resuscitate indicators such as bands, rings, etc., that somebody could have on them all the time?
That is a great question, and one that I'm not sure if I know the answer to. I know that we have do not resuscitate bracelets that we do provide to patients who have filled out out-of-hospital DNR forms, but I don't know if there are universal ones. That's a great question.
Is it common for there to be emergencies in the ER, cases where people come in, they don't have anybody, they can't find the directive and a decision has... Is that a common thing or not that often?
Well, I can only speak here at Parkland Health. It is very common among our patient population. because a number of our patients are homeless, many of them do not have kind of the relationships with their family that they once did. So many of our patients do not have people to speak on their behalf. So, not having an advance directive, and this is one of the things that we're really working on, is when we have people come in through the emergency department, we're doing our best to try to make sure that they have advanced care planning documents already filled out, so that if they find themselves in that situation down the road, we know what they want. We're not having to figure out who's their legal next of kin, is there an MPOA. We have something that says this is what I would want in this situation. So yeah, it is pretty common, unfortunately.
What final thoughts do you have for our listeners?
Yeah, I think I've been in chaplaincy now for 15 years, and the hardest thing that we see in our work is families who are torn apart with confusion, with the burden of not knowing what their loved one would have wanted because they never had that conversation. For the most part, it doesn't take really more than about 15 seconds of courage for us to have the beginning of this conversation. So this is a very natural time for us to begin talking about what we would want if we were to find ourselves in a very unfortunate place. So I would really encourage your listeners just to think about finding some space and some time to have that courageous conversation so that they can honor their loved one and what they would most want.
This has been Krister White, the Director of Spiritual Care at Parkland Health. Steve, as we wrap up for today, it just is certainly a stark reminder of how important this is.
You're so right, Thomas. Very important. Hey, it's a new year. Please consider preparing your advance directives now. And we want to thank our listeners. And we'll see you back next week on The Human Side of Healthcare.